introductions. So our next two speakers are two people I've had the pleasure of working with for the last year on a project with Rare Renal. We're going to hear from Dr. Lisa Willcocks, consultant nephrologist, and Benjamin Stokes. Please welcome to the stage.
Thank you very much for inviting me, and I'd just like to start saying thanks very much for Alex, both for a truly inspirational talk and also for shedding my hospital in such a good light. So, I work at Annenbrooks Hospital in Cambridge. But I'm here to talk about navigating your numbers, and hopefully I've got some slides. There we are, brilliant. Okay, so I'm probably preaching to a converted audience here, but I just wanted to come and talk a little bit about why it's important to have regular blood and urine tests done. So I look after rare renal autoimmune diseases like IgA nephropathy, which is where the immune system attacks the kidneys, it attacks the filters, the glomeruli in the kidney, causing inflammation, which causes a protein leak, which causes damage, and that cycle gradually gets worse and worse, and kidneys can gradually deteriorate and fail. So testing blood and urine is really important because it helps us identify the disease earlier, and it also helps us to identify how the disease is progressing, and it tells us a little bit about what might happen in the future as well. It's really important in these diseases, well, in all kidney diseases, to treat them early and to get the right treatments at the right time. So by looking at those blood and urine results, we know what treatment people need, and we can see how those treatments are working over time, and we can make sure the right patient is on the right treatment to protect their kidneys and make their kidneys work for as well as possible, for as long as possible. I try really hard to get the patients that I look after involved in understanding what these numbers are, so that they can look at them when they've had their blood test done and see what's happening with their kidneys. Some people are a lot more involved than others, and it can be very worrying. I've got one patient who, after she's had her blood test done, she's waiting for the result. She keeps pressing refresh on her screen, waiting to see what that creatinine is going to be and what it pops up as. And that can, although it can be worrying, I think it can be really helpful to at least know what's going on. It's better to be able to see those results yourself than spend the next day waiting in case the phone rings and someone's phoning you up to tell you that the results aren't what they should be. So I think understanding those numbers, seeing what they're like when they come through, can help you take control a little bit of what's going on. So what are these numbers that you need to keep an eye on? So the first thing is the amount of protein in the urine. So when you have a urine test done, we measure the amount of protein that's in there and also the amount of creatinine that's in there. People have talked a lot about creatinine. That's the waste product that ends up in the urine. So your kidneys filter creatinine and it ends up in the urine. When we measure the protein and the creatinine, we can do a calculation to account for how concentrated the urine is, because otherwise you can imagine there'll be different amounts of protein in the urine depending on how concentrated the urine is, how much you've drunk. So you'll see the protein-creatinine ratio or the albumin-creatinine ratio, and that's telling you about how much protein that's there, and it accounts for how concentrated the urine is. We often ask people to bring the first wee of the day into clinic. That's the most concentrated urine. That gives us the most reliable results in terms of protein in the urine. So that's an easy thing to do to test the urine results. When we're doing blood tests, we talk about creatinine. We're measuring the amount of the creatinine waste product that's in the blood. So your kidneys should be filtering it. If the kidneys aren't working properly, then the amount of creatinine builds up in the blood and the creatinine goes up. We can then do a calculation based on that creatinine to give us an idea of how well the kidneys are functioning, and that's called the estimated glomerular filtration rate, or the EGFR, and that gives you an idea of how well your kidneys are working. Everybody's kidney function gets a bit worse as they get older, even people without kidney disease. So an EGFR, if you're in your 20s or 30s, should be over 90. By the time you reach 70, that EGFR will have come down to, on average, 75, but anything over 60 is considered normal. So we know that everyone's EGFR will get a little bit worse over time, but by by testing those numbers regularly, you can plot it onto a chart and you can see the rate at which it's getting worse. And that tells us what might happen in the future. We can predict where that line will fall to as you get older, and we can get an idea for how much your kidney function might deteriorate. And that will tell us as well a bit about what treatments you need and what we need to be doing to slow that deterioration in kidney function. And then the last lot of numbers are your blood pressure. So I can measure your blood pressure when you come to clinic, but half the time people have been running late, they've run up the stairs, they've rushed in, and they arrive in clinic, the nurse does their blood pressure and it's high, and they're worried about coming as well. So much better if you measure your blood pressure at home and you can tell me what it's like normally when you're rested and relaxed, and that's the kind of blood pressure that's really helpful to know about. And that blood pressure should be about 120 over 80, that's what we're aiming for. So these are the numbers that I think are really important for people to keep an eye on. So keeping an eye on these numbers, and kidney doctors love numbers, it helps us understand what's happening. But if you're keeping an eye on your numbers as well, then you'll know what's going on with your kidneys as well. It'll help you understand what might happen with your kidney function in the future as well. And when you come to clinic, you can say, if you're worried about it, say, why has this one got a bit worse? What does this mean? What's going to happen in the future? If you understand the numbers, then you can ask the right questions to help tell us about what will happen to you in the future. And it'll help you, with your doctor, decide on what are the right drugs for you and how best to keep your kidneys working as well as possible for as long as possible. So that's a lot of me talking, but I'm just going to go over here now and talk to Ben. So Ben has got IgA nephropathy, and he had a kidney transplant in 2017. I'm going to ask him a few questions about what that means for him.
I feel guilty for sitting down now. The only reason I didn't stand up, though, I thought it would be a bit too congested, a bit too cosy. But yeah, I think in terms of following on from Lisa, I think when I was diagnosed in 2012, so 24 at the time, I think once I got my head around the idea of it, I think, at the time I was working as a personal trainer, so I was kind of the fit one, the healthy one amongst my family, amongst my group of friends, and I didn't even consider the idea that I might have kidney disease, let alone a particular type of rare kidney disease. And I think it soon became clear that this condition was going to be with me forever, and up until that point, I'd had no real experience of being ill. You kind of just go with it, and if you get a cold, you get the flu. You don't really, why is that? Like, what's actually going on there? You don't really need to know that because you know it's going to be gone in 2 weeks. I think with kidney disease, it's something that's going to be with you for life. And I think quite quickly, I perhaps because of my background, the industry that I worked in, it was like, right, so what can I actually do about this? And when I was diagnosed with IgAN in 2012, there were no treatments available. So I will remember it forever, sat in the consultation room, and the doctor said, well, we can't really give you anything because there's nothing to give you. We'll put you on a blood pressure medication, even though your blood pressure is really not that bad, and we'll sort of hope for the best. And at that point, my eGFR was about 40, so the kidney disease was fairly well progressed. I'm not sure that's the word to use, but had progressed to the point where I wanted to try and take control of anything and everything that I could do to try and prolong, the quality of my life that I had. The doctor said, well, you probably, it's a high likelihood you'll need a transplant or dialysis. It will probably take 10 to 12 years. And as a young adult, kind of being sent home with that information, it was like, so, what am I supposed to do? And so then you go away, you do a bit of research. I think I was given a leaflet at the time. Obviously, I'm sure many people here know when you're in that consultation room, I was sort of glazed over a little bit at first, to be honest. I couldn't tell you what I was told or not told. I think very little of it probably sunk in if I was told anything. And then so kind of took it upon myself to try and educate myself, and then from that be able to ask the right questions. And following on from Oscar, when the doctor said, well, you should have a low salt diet. It's like, well, I don't eat anything processed. I I'm a personal trainer, I eat well. When the doctor said I eat more fruit and veg, I was like, well, I can't possibly eat any more fruit and veg. I look like a broccoli. And so that's where kind of, if you take control of your own care, I felt that it could be more personalised to me. And in an ideal world, you know, we would all have personalised care, and I'm sure that time will come. But certainly when I was diagnosed, that wasn't the case. I think now we're kind of getting towards that point. But yeah, I think that's the power of being able to understand the implications of what you're actually dealing with.
So what else have you done, Ben, that's helped you?
Tools and habits that help me take charge of my kidney care. It's a funny one because there's only so much you can do, right? And I think a number of people in this room are in a similar position where I wanted to understand what I could control and what I couldn't control, because at first I was trying to control everything, and there are a few points where you kind of get frustrated because I'm doing everything I can, and yet, you know, this thing is still getting worse. But then I think that's where it becomes important to try and to do what you can. And I made a couple of mistakes where I'd go in for a blood test, and there's one in particular where the creatinine was particularly high, and it was like panic stations. You know, this was unexpected. You know, phone calls, emergency. You need to come back. We need you to redo your bloods. But it turned out I'd gone to the gym the morning of the blood. I trained the morning of that blood test, and no one had ever told me that if you train and then go and have a blood test, your kidney function is going to look worse. That was never a conversation I had, and there are a number of variables that nobody, I certainly can't remember anybody ever making me aware of, that can impact your blood results. Things like, you know, your hydration. Have you been, you know, maybe you had a tummy bug or, you know, food poison or something that in the days in the run up to your blood test. Maybe you've been traveling a lot, you might be dehydrated. And of course we can't, maybe your blood test was at a different time of day, and we can't control everything, but I think if you can try and take charge of what you can to try and create the most accurate set of results. One, for me, because I wanted an accurate representation of what was going on. And then secondly, for the doctors, for the consultant, I think it gives them the most accurate information to be able to base their decisions on. And I think that's especially relevant now because there are some treatments available for IgAN, but they can't, you know, there's certain points during the progression of the disease when they can be applied. And certainly in the run up to my transplant, you know, it became a bit of a race against time because I had a donor lined up, my younger cousin, but my kidney function was getting worse and worse and worse, and the whole goal, the dream, if you want to call it that, was to have a preemptive transplant, and we could see that I'm only going to be able to hold out for so much longer. And so at those points I was getting my blood tested every week really, because it was like, right, this is getting really tight now. And so again, I had to try and, the more kind of accurate at that point, don't get me wrong, I wasn't doing much anyway, I didn't feel great, but was I eating the same sort of foods before my blood test? Was I roughly the same level of hydration? Had I slept well? All these kind of things that I think do have an impact, certainly on whether they have a result on the actual kidney function. It's not for me to say, but I know they do have a result on the tests.
Yeah, I think that's a good point, Ben. I think if you have some of you may have found this, you have a blood test twice on the same day, and you can get quite, you know, the results are different. They're not the same. So, and I think that's why looking at trend over time is really helpful. And if you have one blood test, as Ben says, one blood test which looks worse, you know, don't panic, because it may be just, as you say, something like you're a bit dehydrated or you've had a steak the night before or something. So I think it's looking at the trends. If it's a bit high, you might have to have it done again. But, you know, don't panic.
And yeah, there were many panicked occasions. But But yeah, being a bit more informed about why those things can be affected, and even if there wasn't any kind of obvious reason, what they actually mean. I think there's a power, as a patient, there's power in knowing what's going on. It gave me a bit of confidence at least, because I think there's nothing worse than being sat with a doctor and they're saying, oh, your creatinine's gone up, your EGFR's gone down, and it's like, oh, what are they talking about? Especially earlier in your journey where it's all very new. So yeah, I couldn't encourage more. Obviously, don't put pressure on yourself as a patient. I think that's going to be unhelpful. But there is information out there now that can empower you with some knowledge.
I think that brings us on quite nicely to the next question, which is what questions do you ask in your appointments to better understand what's going on?
So this is a difficult one, because I'm sure everyone's experienced that time is not very much of the essence in a clinical environment. So the one here was like, is there anything I can do about this thing? You know, you told me my creatinine's gone up. Is there anything I can do? My potassium's really high. Is there anything I can actually do? Because if the answer is no, if the answer is no, it's just because your kidneys aren't working very well anymore. It's like, why put more burden on yourself as a patient and more pressure on yourself to try and do something about something that's completely out of your control? So it's trying to understand, what can I do anything, and then what is that thing?
And lastly, what advice would you give to someone who's newly diagnosed and feeling a bit overwhelmed?
I think the key one is just to ask questions, right? I think certainly in the first few years of dealing with IgA nephropathy, at that point I still felt okay. Yes, my EGFR was 35, 40 by then, but I still felt all right. I was still personal training, I was still active, I just felt okay, very few symptoms. And maybe I just was a bit naive to it. At times swept it under the carpet. Certainly from the mental perspective, I think it was, the way I describe it now, having been through the whole journey, it was like just adding fuel to the fire that was to come, and then, just kind of not, especially as a young person, I think it can be difficult to talk about being scared and anxious about the future. And all these kind of things that you wouldn't have even considered until someone puts this big kidney-shaped thing on your plate. So just ask questions. I think ask questions. If you're looking for information, go to reliable sources. Go to the NKF website, kidney research website. Use the Tracking Your Numbers leaflet. There is information out there now. I'm not sure it existed when I was first diagnosed, or certainly didn't have as much access to it. And I think, it is something that you're going to have to live with for your life. So, you can't, there's only so much carpet that you can sweep stuff under. Just share it with someone.
Thank you very much. Thanks for giving us the chance to talk.